Hi, everyone. Welcome back to the Project DermYouth Podcast. I'm your host, Sharleez Moneem, and today we're joined by a very special guest today, Fariha Ali. Fariha is an inpatient nurse who cares about her patients recovering from serious illnesses and injuries. We're so excited to hear about her journey into nursing, what it's like to be a rehab nurse, and the lessons she's learned along the way. Fariha, thank you so much for being here. I really appreciate it.
Thank you so much for having me. You are such a special kid. I am so excited to be here. I appreciate it.
Awesome. Let me know whenever. Are you ready to start with the questions?
Yeah, absolutely. Anytime.
Okay. So, what inspired you to become a rehab nurse?
I love this question, by the way. Rehab nursing is a little different. The vast majority of our patient population, are older adults. And older adults, I feel, are very special in the wisdom that they impart to us. We learn a lot from them as nurses. And what I really like about working with them is that many times when they come to us, due to the stage of of life that they're in, they have lost a lot of autonomy. So when I'm working with them, I feel like it's my responsibility to restore a little bit of that autonomy, give them chances to make decisions and choices, and give them a sense of self again, like who they were before, talk about what their life was, make them feel good, about their contributions to society. So I really enjoyed this patient population specifically. So that's why rehab nursing was for me.
Aw, that makes sense. That's actually really empowering and that's really nice to hear. I feel like that seems like a very rewarding thing, that you can actually help
Yes.
somebody feel like themselves. And I think that really aligns with our mission as well, where we're trying to bring confidence into teenagers with their skin, just because I dealt with acne. And I feel like that's so nice seeing that in the elder population as well, because I feel like as humans, it's so natural to face like not being motivated by your appearance. I know that a lot of the times, like a lot of these like your patients are after like strokes and after these major things where like when they used to be able to, do normal things like brush your teeth and all of these things, yet now they can't. And I think that's very empowering that you get to do that.
Absolutely, absolutely. It means a lot to them to be with people who understand, who care, who want to listen, who want to engage, and who give them value. They feel important when they're with us.
Oh, yeah, I imagine. So explain what's like rehab nursing like and what usually are your patients recovering from specifically?
Rehab nursing it's a practice or a field of nursing that focuses on restoring. So most of our patients are going to be, well, it's a mixed bag, but they are basically chronic illnesses, disabilities, strokes, heart attacks, motor vehicle accidents, falls, and they've lost certain abilities, the ability to eat, walk, shower by themselves, live on their own independently. A lot of our patients go to skilled nursing facilities or to nursing homes because they cannot live alone after an event like a stroke anymore. So the nursing field, this specific nursing field, is focused on giving them, restoring their activities of daily life, being able to, like you said, their teeth, brush their hair, drive, get in and out of the car. Um, and it's almost like teaching a child to walk, teaching a baby or a toddler how to potty train. There's lots of aspects of it that they've lost. And rehab nursing is giving them their independence again. So, and what was the second part of your question?
Yeah, what normally are your patients like recovering from?
Well, okay, yes, I answered that. It's usually going to be strokes. We get a lot of stroke patients, a lot of fall patients, um, usually, hip and bone joint replacements as well. So a lot of those are actually very good. They're very positive stories, where the recovery is fairly quick. They get
Recovery.
to go home, they're not hurt. But the strokes are very difficult because they just struggle with their self-image and body image too.
For sure. Yeah, I've definitely seen that with my own grandmother. You know,
Oh, I'm sure.
yeah. Like, oh, like she used to be so positive. Like we used to joke that she was like this bundle of energy and she used to keep all of us like very positive. And now after the
Oh.
stroke, it's like we always like put our money on that my grandpa would be sick and she'd be fine. Like I used to joke
Mhm.
that, oh, my grandma's always gonna like live. She's always gonna be there. Like, and now it's just so crazy to imagine something so horrific happened. And I feel like
Mhm.
I feel like now that like my mom's also a rehab nurse and she encounters this, right? Like normally when you see these patients, they're like, okay, these are your stories. This is what happens day to day. But it's like when it happens to you, it's like it's even more like it's just even more heartbreaking, you know?
It is. It is. It's far worse to see your own loved ones, your grandparents, your parents. My parents are older, and my dad has had several strokes, about nine, I would say. Um, but
That's really hard on him as
it
well.
is, it is, it is absolutely difficult. But he's also a pretty tough cookie. So he's still standing strong. He still takes care of himself. He still walks and does everything he needs to, which is a surprise, but you know, also a huge blessing.
For sure. I imagine 9 strokes. That must be so that like that must be a blessing that he's still like he is truly a tough cookie.
He
Yeah.
is.
What does a typical day or night look like for you normally?
Typical night for me when I come in, as soon as I come in, I am reviewing, I get my assignment, I review my patients. Um, there is usually during the day, there's labs that have been done. There has been sometimes imaging tests, blood work that came in. There could be doctor's notes. And then, of course, if it's a brand new patient and I don't know them, then I need to read up on their history. So before I go into the room and talk to them, I have to have a general idea of who and what I'm dealing with and anticipate what they might be asking for, what they might need from me, and have like a rough plan in place for how the night's going to go. So after reviewing, I'll go ahead and introduce myself, walk into the patient's room, let them know, this is what we have going on for you today. We're going to go ahead and do medications. Sometimes it will be on like a toileting schedule, a bladder schedule to help them get to get their muscles working again. So I'll help them with that. Um, and then after that, we do a lot of pain management after bone and hip replacements, joint replacements. So it's a lot of pain management, but it's also monitoring and watching and making sure that they are moving before bedtime. And once they are in bed, that we monitor their toileting as well. Sometimes patients will not ask. They don't know if they need to go to the bathroom or not. So waking them up constantly, like every few hours. Do you need to go? Are you okay? If they've had accidents. So it's a lot of watching. It sounds like babysitting, but it's really not.
It's not. No, I completely understand that. Just because like after that point they really truly can't like it's they truly become like a child. I don't want to
Yes.
sound degrading at all, but after
Yeah.
major injury, right? Like the
Yes.
body knows nothing better, right?
So it's introducing them back to the way that things were before. And for that, you have to be a little proactive. You have to make sure that they are, sometimes they will not communicate. They won't tell you what they need. They don't know if they're in pain. They do know that they're in pain, but they're not able to communicate that to you. So you're going to go in and do a quick assessment and see if they're hurting, what their face looks like. Are they grimacing? And those patients you'll know from before too that those patients are not the ones that will be communicating and telling you that, hey, I'm in pain. A lot of anticipating their needs and making sure you stay on top of it all the time.
Yeah, I imagine. Yeah.
Yeah,
I
but
feel
it's
like
nice.
that's so just sad. Just seeing somebody's like sparkle be lost, but then at the same time, it must be so rewarding to have them gain that autonomy back.
It absolutely is. I've seen in rehab nursing, most of the people that come in, when they leave, they are measurably better. So when they're walking out, we actually have this little clapping party that we throw for them at the front desk. It's so cute and it's so fun. Usually your mom is there for that. I'm not there for that because she's a day nurse. I'm a night nurse. But there's a huge clapping party. We do buzzers, we do tambourines, we jump up and down, we like congratulate them on a job well done. The best part is that when they are leaving, they are just happy. They're happier. They're doing great. And at the very minimum, the bare minimum is that they're on the road to recovery and they know they can do this. So that strength and encouragement is what you see on their face.
Yeah. I mean, how do you even bring that motivation to patients after such a like difficult recovery process? Like, what does that look like?
So for them, for us, from our perspective, we constantly celebrate small victories. We are encouraging them. We are congratulating them. We are giving them pats on the back. Great job. You did amazing here. I love the way you're walking. You're doing so much better than you were a couple of days ago. Look how far you walked today. Look how independently you went to the bathroom today. Look how you've been asking for less pain medication. Small victories like that remind them constantly that they're getting better because they don't realize it. Many times they don't realize it that they're getting better. Time is moving so slow for them, but we are the ones that have to make sure that they know that, hey, 2 weeks ago, you are not in the same position. So you are doing better. So it's just constantly making sure we're verbalizing their accomplishments and achievements.
Must be really, I feel like that must be really good for the patient as well, because it's always reminding them, hey, like you're getting better, right? It's not that you're getting worse. And I think that's really empowering as well.
They
Okay.
love it. They love it.
Aw. And for the last question, what advice do you have for teenagers who want to pursue a career in healthcare?
My advice to teenagers that are wanting to pursue a career in healthcare is going to be to, if this is where your heart is, if you want to be in healthcare, if you want to be a provider or a nurse, my sincere suggestion is to study and hone in your craft. Don't be good, don't be average, be excellent. Really study and really get it down because your patients' lives depend on it. They depend on you to be there. They depend on you to be on top of your game. And they also depend on your passion. Are you dedicated to them? And they can sense it, they can feel it immediately. As soon as you walk into the room, they know, hey, this person is interested in my life and in my medical journey, and this person is not. So my suggestion is if this is where your heart is, focus, study, and hone in your craft.
I think that's really empowering, especially now. Like, I feel
Yeah.
like that's just so important to show our patients that, like, we actually do care about you, right? And especially now
Mhm.
in the healthcare system, right? Like, so
Yes.
I'm gonna be honest with you, we're not in a great place right now in the healthcare, just like healthcare prices in general, right? Like, everything you have to give like a copay. Right now, prices do suck, right? Like,
Yep,
in general, insurance money, there's always something. And I feel like that's so important that we at least have good healthcare workers. And I
absolutely.
we do for sure. And I feel like continuing that for the future is really important.
It is. I agree with you. I think you are on a brilliant track, Sharleez. You're amazing.
Thank you so much, Maria. I really appreciate it. All right, thank you so
Absolutely.
much for t giving you our time, like your time. I really appreciate it.
Of course. Thank you so much for having me. You are an amazing young lady. Good luck on your journey, okay?
And that's a wrap, guys. Thank you so much for watching this video. I really appreciate it. Feel free to subscribe and like. Thank you.